Okay, thank you everybody for joining us this evening. My name is Eton Walls. I'm the director of the medical division here at Sephardi Port William. We really are happy that we have Dr. Hedaya here joining us. I will say that I have had 3 of my 4 grandparents had dementia. My grandmother, my father's mother, who was afraid of traveling, afraid of getting on an airplane. In her 80s, she was in a nursing home and watching news all day long and thought she was living the news that was on the TV. And would call my father and say, "It's okay, I'm in so-and-so place. Don't worry about it, just send the helicopter to come pick me up." As a teenager, this was humorous. As an adult, this is scary because this could be my future. So having somebody like Dr. Hedaya here to talk about dementia and to talk about some of the things that we may know and a lot that we don't know about this disease is very important to us. The medical division is all about educating the community as well as taking preventative steps in having positive health care. So with that, I thank you all for joining us this evening, and Dr. Hedaya.
There's no mic.
There's no mic.
All right, then. All right, thank you very much. It's great to be here. I guess let me give you a little background first. I'm actually a professor of psychiatry at Georgetown University, and I have a practice largely in Maryland. I moved here to Long Branch in June, but I don't have an office here at this point. I'm here specifically really to educate the community. That's why I'm here. I know there's a tremendous need. Just as Eitan said, I have people in my life who've had dementia. My grandfather, Alav Shalom, in 1974 with dementia. My mother, my uncle, my brother, my mother-in-law. I mean, you know, it's just really touched my life. And I would say it's probably touching your here, so it's touched your lives as well, right? How many people know someone with dementia? And how many people are afraid of getting dementia? Some people have 2 hands up. Yeah, it's a big deal. It's an epidemic, actually. It's an epidemic. When we were younger, it was not so common, right? But now it's everywhere, right? So, and we're going to talk about why, and we're going to talk about what can be done. But I would say to you that 20 years ago, you couldn't have had this lecture because there was nothing to do. You had dementia, that was the end of the story. You know, go to the lawyer, do whatever you have to do, enjoy your life. That was it. That's not the story now. So I'm going to explain it to you and then and go through a lot of detail. And we'll take questions at the end. I want to dedicate this lecture to my mother, Sarah Batzakia, who passed in November of 2021. May everything you learn and everything good that comes from this be in her merit, and also my father, Yosef ben Miriam, and Aaron ben Sarah, my brother. I also want to thank Elliot Beebe, who's not here, but who put me in contact with SBH, Lori Hakim, and Sophia, there you are, Sophia, and forget Jack and Debbie because we're not at their house. Okay. All right, so the first question is like, okay, I'm a psychiatrist. How does a psychiatrist end up treating dementia? And the short answer really is that, you know, depression, anxiety, panic, manic depression, and dementia all reside in the brain. And so one thing leads to another, and before you know it, when you're treating root causes of things, then you end up finding out that you can not only treat psychiatric problems, but you can also treat dementia. You can also treat diabetes. You can also treat osteoporosis. Everything's tied together. So that's kind of the short answer. But the original thing happened with my mother-in-law, who had low thyroid function in 1990. She had low thyroid function, and her TSH, if you know what the TSH is, that's the pituitary hormone, tells the thyroid gland what to do. Her TSH was 11. At the time, the upper limit of normal was 10. So her doctor said, you know, I'm not going to treat it. She's just a little bit abnormal. I begged him to treat it. She got down to 9. She got a little better. I begged him to give more. He wouldn't give more. I didn't have the confidence to say, no, you're giving more or I'm giving more. I didn't have the confidence. She ended up dying from mixed edema. Mixed edema is a severe case of hypothyroidism. Why? Because he wasn't thinking. He's looking at the numbers. Right? And I have to say, sorry to say, that many, many doctors today don't think. They don't think. They're working, it's an algorithm. Medicine is an algorithm. Memorize the algorithm, work within the algorithm. But we don't have that luxury. Not when you're dealing with something like dementia. You don't have that luxury, you have to think. So we're going to talk about what dementia is. We're going to talk about whether it's treatable. We're going to talk about what causes it. And we're going to talk about risk reduction and prevention. Okay? So what is dementia? So first of all, dementia is an umbrella term. Right? We got some questions ahead of the lecture, and one of the questions was, how is dementia different from Alzheimer's disease? Well, Alzheimer's disease is just one form of dementia. Right? There are different forms of dementia. There's Parkinson's can have a dementia, frontotemporal dementia, Alzheimer's dementia, etc. So the different types of dementia can present in different ways. And see here you see a list of things that it can affect memory and thinking, language. So you might see someone who's having trouble speaking, finding their words. Personality can change. People get more aggressive, more irritable. They can lose their ability to reason. And they could lose track of reality. I have a patient who has dementia who in the middle of the night thinks her husband is fooling around and a woman's in the house, and she runs around the house with a baseball bat every night. And he's terrified every night, right? So her reasoning is impaired, right? So it can look very different, right? But it's a progressive problem that deteriorates over time, right? So this is the umbrella. This is kind of a list of the types of dementia. You don't really have to know. The important thing to know is that there's different subtypes, and they're not clean either, by the way. So if you have someone, say, with Alzheimer's disease, a type of dementia, if you really dig under the hood, you're going to find out they also have a vascular dementia, meaning blood vessels are not functioning, they're not getting enough blood flow to the brain, right? So it's always a mixed bag. Usually it's a mixed bag. Sometimes head injuries can cause dementia. We'll talk about that. One of the questions is, how do you know? How does it develop, etc.? So there are really 6 stages. And in fact, well, who has an idea? When do you think you can first detect dementia? Nobody. So you can actually see in nerve cells at birth with people who have Alzheimer's genes that their neurons are not functioning properly. Okay? So this is something that starts really early. Now,
What kind of test?
the test is not available, it's in research labs, but the neurons are not behaving properly, right? So from birth.
Wow.
So it's all about prevention, right? You'll see we can actually slow it down, we can actually reverse it 84% of the time, but it really starts early, right? There are different stages. So there's subclinical, meaning you're having something going on in your brain, but you don't really know it, you're fine. And then you have different gradations, kind of like a grayscale, right? And then you have the early stage dementia, middle stage dementia, late stage dementia. There's no defining mark, really. It's just a sliding scale, if you see what I'm saying. So Alzheimer's disease, as I said, start very early. The symptoms actually can start in the 20s. Say Parkinson's dementia, for example. Guess what organ in the body Parkinson's disease starts with? No, it starts in the gut. It starts in the gut. And then the theory, it starts with the neurons in the gut and the vagus nerve from the whole gastrointestinal abdominal area, and the damage kind of travels up the nerve gradually over time into the brain. So constipation can be an early sign. Gastrointestinal problems can be. It doesn't mean if you're constipated you're getting Parkinson's. Okay?
Yeah, right.
Otherwise we will. Right? But the point here I'm trying to drive home is it's about prevention, because you got to start early. You really have to start early. Right? So is it treatable? Okay, well, this is an article from a journal called Dementia in 2022, and they say the prognosis with dementia is poor, it's progressive, there's no cure, there's no treatment. If you're diagnosed with it, within 1 year, you have 30% risk of dying. It's not really the dementia per se that does it, it's all the things that come with it. And the 5-year mortality rate is 60 to 65%. Men have a higher risk than women. Interesting, we have mostly women here. We only have a few brave men.
I'm gonna take your notes for the minute.
It's take the notes and take the notes
We
home.
want to reduce the risk.
You want to reduce the risk. Yeah. So, okay, now, if you go to your regular doctor and say, is it treatable? They're going to say, no, there's nothing you could do. But I've been doing functional medicine since the late 90s. Functional medicine is where we look at nutrition, we look at hormones, we look at the immune system, we look at infections, we look at toxicity, we look at head injuries, we look at sleep apnea, we look at lifestyle, relaxation, relationship, we look at everything that affects the brain. And I reversed my first case in 2009. Now, there was a study that just came out a year ago with Dr. Bredesen and his team did it, where they looked at about 24, 25 people with early stage dementia, early stage, mild cognitive impairment or early stage dementia. 84% were stopped and reversed, 84%. Could have not have said that 10, 15 years ago, right? So we're in a different ball game now, okay? So I'm gonna show you what's involved with that, because it's not simple. It's doable, but it's not simple. And because it's not simple, we really, again, have to go back to prevention, okay?
How are you diagnosed with early stage dementia?
How do you diagnose dementia? So you do MRIs, you do psychological testing, objective testing, and it's not really so hard to diagnose, really.
So what age do people start dementia?
What age?
Like what is there a recommended time to start?
The question is, when do you start to screen for dementia? We don't have a perfect test where you can say, okay, you have dementia, here's the screening. Somebody, one of the doctors calls it, you get a colonoscopy, right? Every 5-10 years, he says, get a cognoscopy. So, you can do that. You could do testing. You could go online. You could do a SAGE test, for example. It's SAGE. You could just download it, do a SAGE test. Do a mini mental status exam. Download it online. It doesn't cost you a penny. But, the truth is, if you are suspicious, then you really want to see somebody and get objective testing. Now, a lot of the time, I've had many patients come to me. They say, I went to the neurologist, and they said, you're fine. But they're not fine. They know that there's something going on, and they're more subtle tests, which I'm going to show you what you can do. But this is just showing you the data is a little bit that 84% of these people, this group of 25 people with mild cognitive impairment and early dementia, 84% improved, 84%. Okay, so that's pretty impressive. Okay, this is actually a paper that I published about a year ago. I want to show you because I want you to understand what's involved. So this is a quantitative EEG. A quantitative EEG, we do this in people's homes, we do it in the office. It's very simple. You put a cap on, and it measures the electrical output of your brain in 19 different places. And that data, that digital data, is taken in to the computer, and it goes through an algorithm, and it figures out, it's absolutely incredible, it figures out what's going on inside your brain to the deepest levels. It could tell us here, this is the surface of the brain. These yellow areas here are areas that are unstable. Okay? The blue areas are areas, this is a specific area and how it's connecting to other areas of the brain, and this connection is very slow. These connections are too fast, right? And we can actually, I can analyze this in great detail, and we can know exactly what's going on and where. This is showing us all the surface areas, each one has a number, all the surface areas, and whether they're functioning, over-functioning, under-functioning. But basically, for our purposes, they're unstable. So this is the brain of a woman, who I'll show you her case, but she, after we treated her, this is her brain, okay? Okay, but this one here is this is after functional medicine, okay? She's changed her diet, she's exercising, she's meditating, she's on her hormones, we treated babesia, a tick-borne infection, we straightened out her gut. You know, we did so many things. When she came to me, she said, I said, you know, you're going to need a pretty extensive treatment, and it's probably going to cost you about $50,000. Not to me. Lab tests and blah, blah, blah.
How old is she?
She was about 55.
Oh, my gosh.
She said, if I don't have my brain, she says, I have 50,000 in the bank. If I don't have my brain, what do I have?
Right.
So she did it. She got a lot better, but she still had symptoms. Then we did the QEEG to see what was going on, and her brain was still having problems. And this here, this crosshair right here, this is the hippocampus. If you've heard of the hippocampus, some of you have heard of it. That's where your memory, you know, Alzheimer's, right? You have trouble with memory. A lot of it's involved in the hippocampus. So what we did is we treated her with a combination of laser, light to the brain, hyperbaric oxygen, which is pressure in a pressured atmosphere, and then this is what happened after 30 treatments. She's basically normal, and so great, we have a cure. Well, it's better than it was, but it's a lot of work.
Can it go back?
It's a lot of work. Can it go back? It's a great question. So if she doesn't maintain the laser treatments, then it slides back because she has genetics that are pushing her in the wrong direction.
Two questions. One is, was she taking any medication?
She's not taking any medication for anything. She's taking hormones, vitamins, diet, exercise, things like that.
And the laser treatment is done just by you or by?
Who does laser treatments?
Right.
Why don't we hold that question for at the end? We'll talk about it. It's a good question. Okay?
What's the name of that laser treatment?
We'll talk about the laser thing at the end, right? Because it'll take a few minutes.
Is she having like issues, diabetic, high pressure?
Yeah, treat the blood pressure, but she normalized. Her weight came down, her diet changed, she took her supplements, she took her hormones, and she did much better, but her brain was still not right. Okay? So it's amazing what we did, but it was very complicated. The point, again, dementia develops over time, right? And a lot of systems are involved. So this is her history. And this is how it develops. She's born with the genetics, this woman. She had relatives with this ApoE4 gene, which puts you at risk for Alzheimer's disease. 2 aunts with dementia. She had a traumatic brain injury when she was 4. Okay? Her father actually beat her up. She was hospitalized, and she was unconscious for a little while. She started drinking at age 24, and then at age 30, she went into a government program, which is a really great program. She was a real explorer, bright woman, and she was exposed to toxins for 6 months that she didn't even know about. At 46, 4 years before menopause, it's the beginning of her menopause, really. They didn't know, but that was the beginning. She goes into depression 4 years later, okay? So you can see things are deteriorating. Now at age 51, she develops facial blindness, meaning if she met you this morning, in the afternoon she'd go, I don't know, I never saw you before. You know, she wouldn't remember. Even watching a movie, she couldn't really track, right? So it's facial blindness. And then her cognitive decline accelerated. So you see the progress, how this thing develops, right? So it develops over time. There are early warning signals. So what did we do? We did diet, we did hormones, we detoxed her from heavy metals. She had mold in her home. Mold is toxic to the brain. She had excessive levels of iron, genetically based. She had sleep apnea. We had to treat the apnea, and we treated infection. It's a lot of work. It was a lot of work, but she got better. But it was a lot of work, right? We don't want to go through that. You know what I mean? It's a lot of work. If you, God forbid, you have it, someone you love has it, okay, well, you do it. But you want to prevent it.
What about prescription medications?
The prescription medicines don't really do much. Very rarely they'll have a good effect. So after the functional medicine, she's feeling some better, but as I said, her brain is still abnormal, right? So we treated her with a hyperbaric oxygen, the laser, and some brain exercises, and she really did much better, right? This is another guy before and after treatment here, just to show you. This is how slow his brain was working here. And then after the treatments here, he had a vascular dementia, meaning the blood flow to his brain was down. So I got him exercise, did a whole treatment, the whole thing again. A lot of work, but a tremendous change.
And you find this out through your EEG?
You find things out, there's a lot of tests. There's been like $8,000 in testing, you know what I mean? The QEG, blood tests, urine tests, saliva tests, you know, it's a whole thing, it's a whole thing. It's like going to the Mayo Clinic, every angle you're going after, right? This guy, you can see his verbal memory here. After the treatment went from the 66th percentile to the 95th percentile, okay? I texted him, John, how you doing one day, just see how he's doing. He says, I'm doing great, my memory is my new superpower. I thought, he's having a good day, that's all. But I decided to test him, and that's what I saw. So it's objectively improved. Okay, so how many systems are involved in dementia? One guy says, well, it's 36 holes in your roof. You got a lot of holes in your roof. When you have early dementia, you got a lot of holes in your roof. And it's true. I would tell you that everyone that I see has many, many things going on. It's never 2 or 3 things. Never, never. I don't think I've ever seen anything like that. So this is just a list here of some of the factors that I put together that are involved. I want you to appreciate the complexity of what's going on. There was actually a paper that said that every system in the body is affected by dementia, or is involved in dementia, let's say. The cost of the treatment, so it's time, it's family support, time away from work, and the cost of a new Lexus coupe. Okay? All right. So we can halt dementia. This is from a Lancet commission. They commissioned a study to look at what do we know from the literature. What's the evidence? What can we actually do to prevent dementia? And that's really the focus, right? And so here, prevention is obviously the best approach. 3 things we can't change: sex, although nowadays maybe we can. Right? Your age, you can lie, but it won't help. Or genetics. Those are the things we can't change. But there are 12 things we can change. And you have things going on that you need to address if you have any of these diseases. Okay? These are all risk factors. Each one of these is a risk factor for dementia. Right? It's not a separate thing, right?
So if you have obesity, you check right away with the
If you have obesity, your risk is
So you
definitely...
check right away? Or
You what?
You just prevent? You check right away for dementia, or you...
If you have obesity, you are at higher risk. If you're 20 years
So then
old,
you should stop being...
you have to change. You have to change your diet. You have to do it. Your genes. So listen, genes are a vulnerability. Genes load the gun, but the genes don't pull the trigger. Okay, what you do in your life is what pulls the trigger. There are very, very few things or conditions that actually are, you've got the gene, you're going to get the disease. All right, very, very few. All right, so if you have any of these things, you see diabetes, heart disease, depression, PTSD, post-traumatic stress disorder, head injuries. So I don't know, maybe in the community we don't have kids really playing football or soccer, but obviously, we do?
No.
Heading the ball, crazy, Mejnoon, right? You can't do that. It's a head injury. It's mild, but it's a head injury. You don't
flying
want,
around on scooters and all these things. It's
you
very
have
dangerous.
to prevent head injuries. There's something called CTE, chronic traumatic encephalopathy. Football players have it, for example. Boxers have it, but people who just have, there's some people who just have a lot of car accidents, for example. You have a fender bender at 15, 20 miles an hour, the airbag doesn't go up, you think you're fine? Probably not. Just think about what happens when, you get hit, your head goes this way, bounces this way, your brain is flying into your skull at 15 miles an hour. So is it Is it terrible? Is it the end of the world? No, but just kind of adds up. Just adds up. So you have to think about all of these things. One of the things I want to, these are the list of the 12 factors we're going to talk about more, but I want to, okay, let me go back here. There's a slide that's not, should be on here, it's not, I don't, maybe it's in the back, but depression, I wanted to talk about depression as a risk factor, because depression is actually the #1 cause of disability in the world, including the United States, depression. And depression is a strong risk factor for dementia. 30 to 50% of people with depression will go on to have dementia or mild cognitive impairment. When you have depression, the neurons in the brain, in the areas that are affected by dementia, the same areas, actually shrink. So if you think of a neuron, a brain cell, like a tree in winter, right? It has all these branches, right? So when you have depression, dementia, the branches actually shrink. You have fewer branches. Now, if you treat the depression, actually the branches can grow. Again, you exercise, mental challenge, eating right, the things you can actually do to grow the branches again. The brain is very plastic. It changes, the brain changes. I had a woman who came to me with a movement disorder. So when she drove to my office the first time, she couldn't even put the turn signal on because she had that little control. And the size of part of the brain called the globus pallidus was in the 2nd percentile, meaning it was tiny compared to most people. After 2 years, she was in the 50th percentile. The brain grew back. It grows back.
Brain cells grow.
Brain cells grow. Yes, you can actually grow your brain cells. You can actually create stem cells with hyperbaric oxygen. There are things that can be done. Again, it's time consuming. It takes money. We want to prevent. But yes, there are things that you can do, right? So that's the great news, right? These are the things. Let's talk about some of these things. Head trauma we talked about, right? Sometimes you can't help it, but certainly if you have grandkids, kids, you can't let them be involved in sports where they're having these mild, so-called mild head injuries. If you have a head injury when you're a child, it may not show up for, depending on the age, till after you're 25 or 18 to 25. Because what happens is, let's say I injured the right frontal area of my brain, and I'm 8 years old. Okay, whatever, other parts of my brain take over. But when my brain reorganizes between 18 and 25, it's trying to reorganize with that right frontal lobe. And it can't, because that part of the brain can't reach the other parts of the brain. And now the problems start to show up, right? So it's not always immediate. This can be delayed, right? So you have to really pay attention to that. Mood, we talked about depression, PTSD, post-traumatic stress disorder associated with an increased risk of dementia, in particular frontotemporal dementia. In particular frontotemporal dementia, but not only, but in particular. So stress management, managing depression aggressively. That could be therapy, it could be medicine, it could be making sure you have the right hormones, it could be exercise, it could be diet. A lot of the same stuff we use to prevent dementia also helps with depression. Medications. You have to be careful the medications that you take. Now, I'm not anti-medicine, but I like, better health, less medicine is my motto, but I'm not anti. If you're having reflux and they put you on a acid blocker, that also blocks the absorption of B12. They don't tell you that most of the time. So if you don't have B12, your neurons actually will deteriorate over time, and that's one of the known causes of dementia. So if you're taking an acid blocker, you really better be taking B12. Most people who take acid blockers, not everyone, actually are suffering from too little acid. And what happens is, you have too little acid, the food sits in your stomach, the bacteria grows, within 20 minutes, 30 minutes, you feel reflux, indigestion, and you get reflux. They say, oh, you need an acid blocker. So it blocks whatever acid you have, so you have less acid, and you say, oh, that feels better. But what you really needed was more acid to digest the food and precipitate the digestive pathways.
I read something This doctor once gave me that. I had the mild, which still continues, and I stopped taking it because I read it's not good for you.
Listen,
But I just read something in Natural Things. What do you think about apple cider vinegar capsules?
I have not used it with patients, but, some people love it, I don't know. But I would say, what I'm saying to you is this: if you have reflux, sometimes you need an acid blocker. If you have Barrett's esophagitis, for example, you need an acid blocker, otherwise you're going to get, God forbid, cancer. But maybe you don't, maybe you need something. So you have to think it through. But so judicious use of medications, right? Okay? Diet, very important. That's like a cornerstone. Diet and exercise are cornerstone. That's the toughest thing. Diet is probably the toughest thing. So here's what I did. So I never was overweight, but being a shrink, you sit all day, every day. You sit, and every year you gain a little weight. So about 10 years ago, I probably was 190 pounds, and I'm not tall, and I had to lose weight. So I did Weight Watchers. Anyway, it was fine. And then I had to do knee replacements a couple of years ago, and then I gained weight again. So I couldn't get the motivation to lose the weight. So what I did, this worked for me, may not work for you. What I thought is, I can't get my own motivation, so I'm going to make a promise to Hashem. Because I don't want to break a promise to Hashem, because God knows what's going to happen to me. For me that works, right? But it took me 3 months to make the promise. And then I made a promise for an hour. Just like 1 hour. I'm sitting down, whatever, 1 hour, that's it, I made the promise. Then I'm making another promise till I'm ready. I made another promise for a day, and I made another promise for a couple of days, and then I said, let me download the Weight Watchers app. I did the Weight Watchers app, and so I've lost 12 pounds in a couple of months. But small successes. I'd say that with diet, you have to start with small successes. Some people can do it like, boom, I've made my mind up, I'm going to do it. But many people can't. Many people can't. So start with small successes. But you have to also know what the right diet is for you. So if you have ApoE4 genes, you don't really ever want to go on a ketogenic diet. You want to maybe go on a Mediterranean diet. Mediterranean diet generally is good for almost everybody. Okay? If you have cardiovascular disease, very important to manage that. That again is diet, exercise, maybe some medicine or other things, right? Exercise is important, but moderate. In the United States, we tend to overdo it. Moderate, walk 2-3 miles a day, depending on your age. Depends what you do. Yeah.
Just going back to the whole genetic piece, and if you have this gene, don't do this. In standard practice, when you're going to a doctor, they're not checking your genetic makeup, right? So how, when most doctors aren't practicing functional medicine nowadays, how do we know, how do we find out about these things?
You have to find somebody who practices functional medicine. That's it. You're not going to convince your doctor to change the way they practice. And unfortunately, our healthcare system is sick. And you've got 6 minutes to see somebody, and if you don't document properly, the Medicare comes after you for $10,000 per chart. I mean, it's a crazy system. So you have to find somebody. You have to look around. And actually, on your handout, I gave you some direction on how to find somebody. Toxins, surgeries, multiple surgeries, anesthesia, right? Big problem. Mercury, mold, a big problem. If you're living in Jersey, older homes, etc., mold is a big problem. Matter of fact, if someone has mold in their home and they don't want to get rid of it, I won't even treat them because they'll never get better. Never get better. Infections, Lyme disease, tick-borne diseases, rampant in New Jersey, rampant, right? You have to identify those. So if you're having arthritis that kind of moves around your body, or chronic fatigue, or achiness, you got to be suspicious. You have to go to somebody who's going to think, a functional medicine doctor who's going to actually think. Because if you go to LabCorp for a Lyme test, if it's positive, great, but if it's negative, it means nothing. It means nothing. Education and mental challenge, very important. Very, very important. So it's very interesting that if you speak let's say you speak 2 languages, and you actively use 2 languages or 3 languages. And then let's say you're diagnosed with dementia, and they look at your brain. Your brain will be in, I'm not saying this the right way, this is not going to make sense, but your brain will be much worse shape than someone else who was diagnosed with dementia. In other words, let me flip that. In other words, when you know 2 languages and use 2 languages, you will not show symptoms of dementia, even though you have the disease, for a lot longer. In other words, your brain is going south, but you're doing fine. You're doing fine because your mental challenge, right? So languages, reading, writing, playing bridge, let's say, challenging your memory, or whatever it is, novelty, doing new things, trying new things. You have to challenge your brain. You have to challenge your brain. The more you do that, the better it is for you. The better it is. And the higher your education level, the better it is. But there are lots of ways. You don't have to have a PhD. Sleep apnea, very important. Sleep apnea is when you're sleeping and you kind of stop breathing in your sleep. You may know it, you may not know it. You may snore, you may not snore. There's different types. You could be thin and still have sleep apnea. If your blood pressure is high, you wake up with a headache, you're tired, you're napping, you could have sleep apnea. If you have someone with dementia or early dementia, or you're getting close, or you're suspecting, this is something you have to look at, because you can't detect it on a clinical exam. In other words, I learned this about 15 years ago. I was talking to a guy who had anxiety. He was about 45. And I asked him about apnea, all the questions, and I don't think he's got it. But he decided he thought he had it, he got a test, and he did have it. And when he treated his apnea, his anxiety went away, right? But I didn't get one symptom on his history, and certainly not on his physical exam, that suggested apnea, but there it was, he had apnea. So sleep apnea is a big deal because it's associated with increased risk of dementia and heart disease, etc. Social connectivity, I think in our community we got that covered. I think we're great. We're so superior.
What do
So
you do
superior.
for sleep apnea besides the CPAP? Is there something else to be done for sleep apnea?
So the question is, what could you do for sleep apnea besides CPAP? So you have to look for the cause. So of course, let's say if you're overweight, weight loss, you could be hypothyroid. If you're hypothyroid and you treat that, the sleep apnea could go away. Sometimes it's central, which is meaning neurological, and there's nothing, you have to use the CPAP. So those are the main things. Hearing aids, also important. If you have a hearing problem, use the hearing aids. Diagnose a hearing problem and use the hearing aids because it's stimulation to the brain. If you can hear what's going on, it's stimulation, right? So these are the things, the basic things. Now what's not on here is hormones. Hormones are critical. Hormones are like miracle grow for the brain. Now, there are a lot of different hormones, but I'll talk primarily about female hormones, okay? Estrogen, because estrogen got a really bad rap with a study, I don't know, 8-10 years ago. And in that study, it showed increased risk of various cancers with women who use female hormones. But the hormones that they tested were synthetic hormones. They're fake hormones. So it's what was it called? I don't even use it anymore. It's horse estrogen, right? So it's what they put in the birth control pills and the female hormones is the estrogen that the molecule shape is the same as the estrogen that horses have. So it's a massive experiment in women in this country. They're taking horse estrogen, and then they say, "Oh, you get cancer." Well, you do. But if you use bioidentical estrogen in a patch form, nothing oral, in a patch form, it actually reduces your risk of cardiovascular disease. It reduces your risk of cancer. It reduces your risk of dementia. Okay? So you want to get on female hormones with progesterone, bioidentical, as soon as you're in the perimenopause, menopausal stage. Of course, clear it with the GYN, of course, family history, BRCA genes, etc. But for most women, this is really important. For men, testosterone, DHEA, other hormones, thyroid hormone, etc. these things are critical. And as you get into like perimenopause and you get into andropause, that's where you really want to start looking at these hormones, because that's when they start to go south. It's very, very important. It may be even before, if your person's been stressed for years, you may have adrenal problems, adrenal hormones, etc. So these are all doable things, and they actually will grow your brain. I've seen it on the testing. Right, I've seen it. It actually.
May I ask a question?
Yeah.
Is the patch form the only way that works, or is the gel just?
You could use a gel, a cream, or a gel.
cream,
Yeah,
gel is
yeah. Some
equally
people, a lot of women like that
sufficient.
better. I use the patch with women, but
It works.
yeah. It's just the most important thing is bioidentical
bioidentical.
and nothing oral. Nothing
Correct,
oral.
correct.
Most important. So this is a simplified, which is basically identify and remove the damaging factors and put in the growth factors. That's a simple model. Take out the bad stuff, put in the good stuff, right? So that's kind of, I think I'm going to stop here and just I'll take questions and yeah.
The functional medicine, is that very popular? Is it a minority of practitioners?
Functional medicine is a minority. It's been around since the late 90s. You can go to the website, the Institute for Functional Medicine, and you could look for a practitioner. You put in your zip code. Just make sure you look for a certified practitioner. Very important. A lot of people take courses and then they say that they're functional medicine practitioners, but they're not necessarily certified.
What if you had a head concussion like 40 years ago?
If you had a head concussion, it could be affecting you, and you can do a quantitative EEG, and you can see, and we've actually reversed it. You can actually, now the cells that are dead, right? But there are cells that are actually kind of, we say liminal, meaning they're alive, but they're asleep. Like this woman I told you about, who couldn't recognize faces for 7 years. When I did laser treatment, one laser treatment to the left side of her brain, and her facial recognition problem went away. I was shocked.
So what do you tell your doctor? 50 years ago I had a concussion, check me out?
You have to find someone who does this. You have to find someone who does this. That's what you have to do. And then there are treatments. There's hyperbaric oxygen, there's a laser treatment, there's so many things to do now. So many things. Again, in the handout, I gave you a website. You can connect with doctors who do this stuff.
Just to check you out, even though you didn't have symptoms in 50 years.
Just to check you out. Yeah.
It sounds like traditional medicine is really not on that path. They're not on.
No, traditional medicine is not. Listen, that study with 84% of people getting reversal should be headline news,
Yeah.
front page news, right? But it's not, because the pharmaceutical companies,
Don't want it out.
they do not want this out. They do not.
And what makes you qualified for a doctor to have a quantitative EEG?
So it's something you study. Quantitative EEG is something you.
No, like as a patient, what would make the doctor say, oh, she needs a.
Why would you do a QEEG?
Yeah.
Why would they allow you to do it?
Right.
Why would they allow you?
Insurance pay.
What,
Oh, insurance, forget insurance. I'm not talking about insurance. Insurance is forget insurance, okay? Forget insurance. You're dealing with this, forget insurance, okay? That's a separate issue. Why would you want a QEEG?
why would the doctor say, oh, that's what's needed for this
I
patient?
do a quantitative EEG on every patient now, because I can see the networks in the brain, how they're functioning. It gives me clues about the causes of problems. And it gives me so much information that it's such a game changer in my practice that I'm blown away by it. I'm just simply blown away. I can't even tell you. That's why I published that paper, because I was blown away. I gave this woman with the facial blindness a laser treatment based on the quantitative EEG. One treatment and her facial blindness was gone, because those cells were alive, but they were asleep. I needed to wake them up.
And the way you find them is through that EEG.
You find it through EEG. We've reversed 2 cases of aphasia. People couldn't speak. We reversed 2
So
cases.
someone wanted that. just going to somebody and saying, I want a quantitative EEG.
Now, you have, again, you gotta
It has
find
to
the,
be
you
something-
gotta look for the practitioner, right?
Right,
You
so
gotta-
even if you have the practitioner who has done it, what's next? Like, how does he decide that
Well,
you,
no,
that you're
they
a
have to,
candidate?
they have to decide, after taking your history and a physical, what is the appropriate workup. You know, everybody's,
I think she said, could you just go in and say, I want to have this done?
no, that's crazy. You don't want to go and tell the guy, this is the test I want. You want to find the right doctor who knows about these things and then say, these are my symptoms, what should we do? Assuming
That's
you're
what I'm
trusting
wondering,
your.
like, what if you don't have
What
major
if you have
symptoms, like
symptoms?
that, the case that you showed, she had a lot of things,
Yes.
but people
What if
here,
you-
like, we don't have those
So
major.
if you feel like, oh, I want to check how I'm doing, that's a different story. So you find someone, you say, you could say, I want a cognoscopy. I want to assess my risk for dementia. Do you do that? Do you know, are you aware of all the systems that are involved in putting me at risk? And they should spend at least a couple of hours with you, going over your history, doing some lab tests, physical exam, and see, okay, here, this is a suspicious area, this is a suspicious area, let's test these areas and see what's going on, and then let's correct them, and then retest, make sure we succeeded in treating what we need to treat, and then you do it, and then I'll see you next year, see how you're doing. If you want to get some testing, cognitive testing, you could do that, and then retest in a couple of years, or something like that. It's that kind of that.
So I think you said I don't see where you would find those doctors. Where were you saying?
So on the, I think, let me see here. It's
On
in-
the
in
first
the-
page, oh,
It's on the bottom of the first
okay,
page.
thank you, sorry.
Thank you.
Let me ask,
Thank you.
Yeah.
what's so bad about not recognizing faces?
So if you don't recognize faces, if you're in business, this woman was in business.
Then 3 days later, I don't remember.
No, but it's, if you're in business, it's bad, right? So if you're watching a movie, it's bad. If you went to a party and you met someone, a week ago and you don't remember them, it's embarrassing. There's a problem, and they think, they don't know, they're offended. Oh, you don't give a damn about me? It has repercussions, and it just means basically that specific area of the brain is not functioning
She's
properly.
saying maybe they should just take a look at them so they can remember.
Well, you
them.
can, you could do that. You could do that.
There's games you can,
That's like.
how about if you don't remember their name?
Names are another thing, yeah, so names are another thing. So that's another question. So you bring up a question, like how do you know, like if you're misplacing your keys, right, or you can't remember a name, how do you
Why
know
you
if
went
this means
upstairs,
anything,
when you
right?
get there, you don't remember why you went up.
So these are all clues that something's going on. That does not mean you're going to dementia.
Okay.
Okay, but it could be an early sign. So if you go from one room to another and you can't remember why you went there, that's called working memory. That's a particular area in the brain, and it's important. It doesn't mean you have dementia, it doesn't mean you're going to get dementia. It could mean you're on your way. You don't know. You have to assess it and treat it. So how do you treat it? You look for the sources of the problem. How's the diet? How are the hormones? Are there any toxins? Are you exercising? You go dig deep to the root causes. You treat the root causes after you identify them, and people get better. But again, it's about prevention. It's about prevention. So we have young people here, and that's great because it's about prevention. You start, the earlier you start, the better.
What does it mean when I'm having a conversation in the middle of a sentence, I go blank and or
Yeah, if you go blank in the middle of a sentence, that's your working memory. Now, that could be anxiety. So if you have anxiety, it could be like derailing your frontal lobes, or it could be that you're having an early memory problem. You have to, again, you got to do the detective work with the doctor to figure out what it is. Yeah.
What's your thoughts on that, it's the medication,
Donepezil, it doesn't do anything. These medicines don't really do anything.
but even, it doesn't slow it down?
If it does, it's so slight. There may be a few people here or there where it has a good effect, but when you look at the studies, they're so weak. It's not really, they're not really
Is
good.
it harmful?
Would you not prescribe it?
I wouldn't prescribe it, I would go
If
to the,
someone keeps and said, you know that they have it, You wouldn't say try this?
I wouldn't do that. I'd be looking for the root causes. Let me address the laser question, because the laser is a question you asked early on. So, so the laser, basically what happens is you can shine lights through the skull. About 2.5% of the light goes through the skull, and the photons, the little particles of light, basically they release something called ATP, which is an energy molecule, and so the cells that receive the light get energy. When they have energy, they can actually repair, they can actually do what they need to do, right? And so they can wake up, they can, et cetera, et cetera. So there are different types of lasers. One is it's a medical grade laser. That's what I use. It's anywhere from 15 to 60 watts, meaning it's powerful. And based on the QEG, we decide where, we're going to point this thing. And then there are laser helmets. They're really not lasers. They're LEDs, right? Light emitting diodes, and very weak. But you wear the helmet for 20 minutes, 30 minutes every day, and you get a little bit of light. And there's some studies that show that it's effective. The problem with the studies is that they're done by the company that makes the helmets. But it still may be that they work. It still may be that they work. I don't know, but that is something that you could try. The laser sometimes, for dementia, if it works, you need to continue. For depression, for example, we use it for depression, and you may not need to continue. Or, for example, with the woman with the facial blindness, we didn't need to continue. So it depends on the condition.
What's the difference between
medicine,
Namenda? Yeah, so Namenda, again, these things have, the idea of Namenda is that it blocks glutamate, which is like a pro-inflammatory molecule in the brain. And, if it has an effect, it's a mild effect.
Does it hurt?
No, I mean, if you don't have side effects, it doesn't hurt. I don't think it hurts. But I think the point is to try and get to the root causes. If the Namenda is helping a little bit, continue it. It's not a bad thing.
It's very hard to tell.
Because it's not working.
tiny?
You know what I'm saying?
They up the dose for that and the donepezil, so I'm wondering.
You have to get to the root causes. Now, it depends, again, the other thing is this. It depends, if your mother-in-law, you said?
My mother.
Your mother. So let's say if she's in an advanced stage, hopefully not, but if she were in an advanced stage, you could throw what I'm saying in the garbage because it's too much work. There's too little benefit at that point. If it's in an advanced stage,
I would say medium.
if it's medium, you're on the fence. You could try things that might help or at least slow it down,
I have a question. What age would be appropriate to do these things for the early intervention? In their 80s, would you consider that already, even if it's just showing up and started?
Or you jump on it.
Jump on it,
yeah.
If they're in their 80s, it's okay.
I would say if you have a family history of dementia and you're perimenopausal or andropause or something like that, immediately, get your hormones checked.
Right.
Immediately.
I'm talking about the 80-year-old patient.
The 80-year-old,
Yeah.
if they're mild showing symptoms, then you want to evaluate them. Yeah. Now, there's always a balance between how hard this program is and how it affects your life. And, like, for example, today, I was speaking with a woman. I've been treating her for a couple of years. We've stopped it, but she has serious spatial problems, and we haven't been able to reverse them. And but she's enjoying her life. They're going to Europe for 6 months, and it's like, enjoy your life.
Yeah.
We're doing a lot of stuff. She's doing the diet, she's doing the hormones, she got off the cookies, she got blah, blah, and enjoy your life,
Does inflammation make a difference in your body?
Inflammation is what's going to kill us all if we don't get hit by a truck. Right?
How do you get that down?
Inflammation, you have to find the sources of the inflammation. It could be your gut, it could be mold, it could be a chronic infection, it could be your adrenals, it could be stress. That you have to find the source. Again and again, I say, get to the root cause of the problem. Always look for the root cause of the problem.
Did you say that osteoporosis can be like a cause, and if so, what is there to do? Because it's extremely difficult to reverse.
Osteoporosis is not a cause of dementia, but the processes that cause osteoporosis are also involved with dementia. Does that mean if you have osteoporosis, you're getting dementia? No, but it means you're probably at a higher risk. So I treated a woman, this is 20 years ago, for severe depression, using functional medicine, all this stuff, and she had osteoporosis and she had diabetes. And in the process of doing all this, her osteoporosis reversed. All right? But it's, again, it's a lot of stuff. So prevention, right? Yeah.
Two questions. When you're saying hormones check, what are we checking for exactly? From going to
The hormones check, there's like 7 or 8 different hormones, so it's a lot of, there's probably 30 tests, you know what I mean? But you start by taking a history, the physical exam, and then the doctor will decide, you know, what hormones to check, you know?
And my other question is, so if somebody's with depression, if you're taking an antidepressant, is that something that, is that
good?
Is that good? Yeah.
So antidepressants actually, first thing is they only work in like about 30% or less of the time, but they actually increase the branching of the neurons. So it's actually good, assuming it works, you know, but antidepressants are actually good in that way. And particularly if they're working for the depression, it's even better, right?
Even if they're not working for the depression? So you'd say
If they're not working for the depression, go back to the root causes. You've got to go back to the root causes. Yeah.
TMS, are you familiar?
Yeah, RTMS.
Right, so does that appear to be somewhat effective in treating dementia?
No, I don't think so.
Okay, so
RTMS is a, I've investigated it really thoroughly.
Right, yeah.
Actually, I was actually going to buy a TMS machine 12 years ago.
Right.
And I investigated, I read all the studies, they're very weak, but it's great marketing. The hospitals are making a lot of money on it. The relapse rate is really high for depression.
What is a TMS?
It's a magnetic, repetitive transcranial magnetic stimulation for depression. They're testing it for different things, but it's a weak treatment, but there's a lot of money behind it.
All right, this was
Are there
curious.
issues with taking statins?
So the question is, are there issues taking statins?
To increase, is it beneficial or is it?
The answer is I don't know because there's studies on both sides. I don't know the answer. I don't know the answer. Okay. Well, last question. Go ahead.
Is there a benefit, let's say, to taking things like vitamin D if your vitamin D levels aren't necessarily low or B12 and such?
Is there a benefit taking
Let's
vitamin
say
D?
vitamins that you're not necessarily low on it, but let's amp it up to make sure
So,
that we...
it's a vitamin D. You want to measure your levels, okay? B12 is a little different because if you take B12, you're going to have high levels. If the best way I can explain this is imagine you have a road going from point A to point B, okay? So in the middle of the road is a traffic circle, okay? And at point B, you're coming out with Toyota trucks, right? Point A is going in parts, right? But there's a jam in the circle, okay? So now, if you just keep feeding parts in, the levels of all those parts are going to go high, but they're not going through the traffic circle, so you're not putting out the trucks. But if you just measure how many parts are in this first part, you go, oh, there's way too many parts. Well, yes, but you're trying to push traffic through the circle. So when you just measure a B12 level, you're measuring a level, but you're not measuring the output of the system. And the output is what matters. Right? So you measure the output by looking at the size of the red blood cells. You measure the output by looking at the homocysteine, different things like that. So you can't do a simple B12 level. If it's low, it's important. If it's high, it doesn't tell you enough. All right, thank you, everybody.